As I mentioned earlier, this is a partnership with these many institutions, but one of the founding partners, and very important, was the Duval County Medical Society. And we have with us today Ashley Booth, an emergency room physician and faculty member at the University of Florida, Shands, Jacksonville, and we just wanted her to give a word of welcome too. Ashley, thank you.
I'll be brief. I know you guys are eating lunch and we have a lot to do today. But it seems weird that I'm giving a welcome in the middle of the day, but I just wanted to say that the Duval County Medical Society has been partnering with the Center for Global Health and Diplomacy since the inception of the Caring Community Conference 6 years ago, and we continue to partner, and we're very excited to be here today to be a part of this. And for all of you, we are here to help physicians practice medicine and take care of the needs of the patients in all of Northeast Florida. That is our mission, and that is what we are trying to do. And we are so glad to be a part of this conference. So please continue with lunch, and I just wanted to say hello.
Thank you, Ashley. Thanks very much. And just another word about words. As you heard, patience is a very important word. Obviously, we want to be treated like human beings with respect and so forth, but when we're a patient, we're vulnerable. And that's why it is one of the three fundamental global traditions of the health professions: medicine, nursing, physical therapy, so forth. The first commitment is to the patient. And in many governments in the world, they don't like that. They really find the health professions threatening because they're very well respected. And they're very well respected because of those three traditions. The first is the caring nature. Second, the ethical commitment to that individual before government, insurance company, family, or anyone else. And then finally, the scientific commitment. So those are three ingredients that inspire trust and hope. And that is a wonderful, powerful tool that health professionals have as long as we keep unified and remain true to those fundamental traditions. The second word is provider. Provider can mean a whole lot of things. The government started using provider in all of its Medicare directives in the 80s. And it was a very favorite word of managed care. And managed care, as you know, was a debacle in many ways and had a significant impact on the termination of the first and very fine multi-specialty group in Florida, the Riverside Clinic. So when I first went to Hungary, they said, "It's nice of you to be here, but don't bring us any more favors like managed care. If you change again, at least do something that doesn't mess us up." Then finally, there's the word consumer. Now, not only did Medicare like to use provider, which lowers things frequently to the lowest common denominator in terms of science, ethics, and caring, but they like that word customer or consumer or client. Well, there's nothing wrong with a customer, consumer, or client, but if you're a patient, that's nice to be treated nicely, but you also want to be treated with that ethics, caring, and science at the same time. So that's why we try to remind ourselves that words matter. There are some very specific reasons why people use words or companies use words, but we don't want to get seduced into mystery words that aren't meaningful and are sometimes very counterproductive. It's a great pleasure also to thank these institutions that have developed a program and the support that they got from their administrations in starting these programs that were expensive to them. We had support for bringing in faculty, Bill, and others to get it started, West, but it still was very expensive for them to commit the staff time, professional, administrative, to implement. So it's really a wonderful thing. And in addition to the 6 that are here, Baptist is starting next. They had other implementation priorities of their electronic records, which was certainly understandable. We couldn't do everyone at one time, but they have plans to start in November, December. So it's really a wide distribution throughout the community and much further. But of course, I think that more can be said and really better by our leader of this event who got us started at the very beginning. Bill, would you take over? Thank you very much.
Thanks. I'm going to stand down here because I don't really like to be behind the podium too much. a great question was asked, and I asked you to hold on to it in terms of really how do you get this to the middle managers? How do you get it to the frontline staffs? How do you keep it alive? How do you make it relevant to their work? And what I'm saying it is really the connecting, it's the caring, it's the compassion, it's really making certain that the person that we're treating, we're talking to, we're helping across the table has that connection with us, that the staff person that we're connecting with has a real connection and a sense of trust. So I'm just going to give you a very few-minute high-level overview of how we got to where we are in the community, and then we're going to hear from 4 of our institutions about what this journey has meant to them, what it's taken to really begin the journey, what it's taken to sustain the journey, and what are some of the next steps in terms of where we go from here as really part of the puzzle to fix that daunting task that was laid out for you earlier this morning. So, when we look at the beginnings of this, this slide has some simple things on it, but actually some complexity to it. Every single healthcare organization, if you ask their leadership, what is it that you really are going to strive for? They're going to say quality. And that means something different in terms of how alive that is and how seriously you're delving into that. One of our missions where I'm at right now is actually our mission statement, and it's to get each and every patient to his or her desired outcome, because not everybody has the same desired outcome of their care, without harm, without waste, and with a great patient experience. Those 4 phrases. And the real question is how serious are the leaders that sat at this table? How serious are you as leaders really taking that to heart to do something about it? Because that is going to be your answer for 30 to 50% of the waste, of the money that we really need to recoup to keep our health systems alive. So these discussions, when we started this, and I'm starting you from the very beginning and we're going to go out, took over a year. Over a year with leadership team to just ask that question, what does it mean? And how serious are you about this? And when we look at some of the data behind it, when you look at understanding this gap of what patients really experience and what they want, the top things, they want to be treated with dignity and respect, be listened to, be talked to, take concerns seriously, spend enough time, and truly care. This is the connecting, the communication, the compassion, all which brings us back to Liz's talk. All of that has to do with communication, effective communication, and you can see all the other things are important, but less important to the people that we take care of each and every day. That really shows us the patient experience. We can do the same for safety. When you really look at causes of why we did wrong site surgery, when you look at why we really have had a significant sentinel event, about 70% boil down to the way we communicate, our teamwork, and our trust. And each time we have those errors, we waste a significant amount of resources. Millions in each of our own hospitals every year. That's where the communication piece comes in. Outcomes, there's nothing getting less complex about the medical care that we deliver, and we have to really work as a team. And part of that team is the way we communicate, the way we show up, the way we trust each other. So that comes to the value statement. No matter what we do in life, if we go to Target, if we go to Nordstrom's, we always ask ourselves subconsciously, is it worth it? Is what I'm getting out of this experience worth it? And this is every single person that walks through our healthcare institution to work is doing something to affect one of these variables in the equation. And communication actually is not just the service piece. It's not just having patients say they had a good experience. It is having them follow through and really follow the recommendations, and having less readmissions and less emergency room visits and better outcomes and no wrong site surgeries and less errors. All waste, tremendous waste for the system. Liz already alluded to this. This is what happens when physician communication is really done effectively. Patient satisfaction, adherence to treatment, medical decisions are more appropriate, malpractice claims drop. For those of you wondering, can you afford this program in your own institution? Think of one less malpractice claim, and you will pay for this program, not for 1 year, but for 5 years. And more importantly, we heard about burnout. We're all going to go home every day with where we're at with feeling tired. And we have a choice of going home with a bad tired, and we've all done it, and it's not a good feeling. Or we can go home with a good tired. And it's how we show up and really connect with each other that makes the difference in what that feeling is. And you can generate a lot of energy by doing this. So what we developed with the help of the American Academy for Communication in Healthcare, that's AACH, is a 4-hour curriculum to begin the journey. And again, I'm saying begin the journey. People aren't transformed over 4 hours, but they're given the skills and the tools to really begin that journey, and then it's our obligation to build on that, and you'll hear how we've actually been doing that at different institutions and points along the way. We've trained our own faculty at all of our sites to be able to give this from peer to peer. A tremendously important piece of information, because it's not as effective to have somebody come in from an outside company telling your team how they should be doing their work and improving their skills. It's better to have somebody who walks in the shoes every day, can help each other get better and build that trust. So it was intentionally designed for that. We focused skills on listening. How do we set agendas? I've heard time issues. Yeah, we can't do everything. But what can we do, and what can we come to some grip together to do together in the time that we have? And a lot of time on connecting. You're going to hear words about the pearls. How do we connect and have that compassion? And then how can we get it to every single individual in the healthcare institution? Longitudinal, the program is because it isn't. It's the beginning, so we build on it, and you'll hear about that every few years. And we provided CME credits for it. So can we teach it? This is data from the Mayo Clinic where we started, and I can tell you I've just got done with the first year and a half at my hospital that I'm working with right now, and the data is, I can put the same data up for this. When you look at how well does your doctor listen to you, it goes up and up and up. The gray bar is the target. We haven't quite reached target there. Using words that your patients can understand goes up and up and up. Giving clear instructions, the impression of the doctor and the provider, and the overall quality of care, that perception. So can you teach it? The answer is yes. Can you really give skills? It's more than a PowerPoint. It's way, way more than a PowerPoint. It's really skills-based learning. The answer is yes. What about between your healthcare professionals? If you look at respect between the physician and allied health, double-digit increase over a few-year period of time. How you feel, you judge your service from your colleagues, and are you treating each other with respect? So you can see a measurable difference as you really embark on this work. So as I said, we started, this is the ripple effect. We started with the executive board at Mayo with about a years of discussion, and not easy discussion. We take for granted when everybody says, yeah, we're all about quality, but are you really all about quality? And I wish the CEOs were really right here right now, because that is the real answer. And it took a year, and it took some tears on my part to have those discussions. I remember several times walking back to my office and actually sitting down and crying and say, are we really going to do this journey or not? Started from there. Then we had our trainers from outside. We trained our physician faculty, our allied health. And then with Yank's offer, as well as the great reception from the community, we started to work and break down our own barriers within the community of what can we do to make this the best experience for all of the people that live in Northeast Florida. That's the goal. And we took this to several of the institutions that you're seeing that are going to talk to you in the next few minutes, and others that are listed on this board, and the ripple effect continues. And we continue to bring this across hopefully all of our organizations. And we need your help, and we want to listen to you a little later today of how you can help us actually continue that ripple to get broader and broader and broader. So these are the institutions that have participated so far. And as Yank has alluded to many times, we are so grateful in many ways for the different types of support these various institutions have really lended. The work would not have been possible without it. So with no further ado, I'm going to start with, we're going to start hearing the stories from our institutions with Dr. Berger from the University of Florida, and then we'll have Dr. Oberman from Navy, and Dr. Patel from Nemours, and then Terry Vanziali from the Mayo to really talk about their experiences, what it takes, infrastructure, how to build it, how to execute it, and what happened in their organization as they really walked this journey. And then we're going to turn the conversation over to you after these presentations. Thanks.